At 6, there are two main programs that help Americans who are facing food insecurity. The Supplemental Nutrition Assistance Program, SNAP, we've been talking about, and the Special Supplemental Nutrition Program for Women, Infants, and Children, known as WIC.
As the government shutdown continues, there's been some confusion over which of those benefits are at risk. Chris Hoff, Executive Director of the Lake County Health Department, is joining us live now to discuss. So, Chris, for folks who maybe receive both of these benefits, which is the impacted one, SNAP, and then if you want to explain the difference there with some of the WIC benefits.
Sure. Both very important programs that provide support for families to buy nutritious foods, stay healthy, get the things that they need. SNAP is the program that is really at risk right now. That's the program that, because of the shutdown, we expected to see a delay in payments. The ruling today is really encouraging that money should continue to flow to those recipients, but it'll be a couple days until we know for sure. WIC, on the other hand, is really a program that's targeted to pregnant women, new moms, and their children to make sure that they have access to healthy foods. They have breastfeeding support, referrals to other programs, and really helps them get off on the right foot at the beginning of life. WIC is not impacted at this point. There's potential for that down the road as the shutdown may continue. But SNAP is the program we've been most worried about right now.
So there's probably a little bit of overlap, but as I understand it, Chris, both are federally funded programs. So can you talk about the difference in what pots the funding come from, because one's affected and the other is not?
Yeah, the federal funding flows from different sources, and so SNAP is separately administered. And you're right, some people are eligible for both programs, may receive benefits through both of them. But the funding for SNAP is the funding that has been suspended and was set to run out tomorrow. And we still expect there to be a disruption to people receiving those benefits, which is really unfortunate, right? I mean, this is the first time in 60 years that those benefits may not be going out to people when they're due, thereby preventing them from going out to get the foods that they need.
Yeah, so I'm guessing there's a lot of confusion though, right, from your clients who are scared and not sure. How are you communicating to them, and what are they saying to you?
Yeah, lots of confusion, right? There's lots of news stories. There's lots of information coming from organizations who provide those benefits. People are sharing information, and so I think getting accurate information is really important. Again, for now, WIC continues as is. If you're a recipient of that program, I'd encourage you to contact us if you are a recipient of Lake County Health Department care or any other provider that provides that. Really to get accurate information. State of Illinois has a really nice resource for those programs through the Department of Human Services that provides accurate, up-to-date information. And is really a trusted place to go for that, kind of cut through the noise and get the information about what's going on for your particular benefits.
So we know the judges made this ruling today. This expires tomorrow, and we hear that the House and Senate should be coming back not till Monday. So if Monday they make a decision and the funding is restored, what are you telling people as far as how long a delay could be? Would it be a few days? Could it be a week or more? And then in the meantime, are you directing them to local food pantries if they need that assistance?
Yeah, it's a great question, and one I don't have a good answer for. We understand it could take a couple of days to get those benefits flowing, even after the federal government starts making those funds available. So there could be a period of time where people do not have those benefits. So we're encouraging them to find resources locally. A number of food banks, food pantries, the Greater Chicago Food Depository is making resources available on different resources that could be out there. Important to note, too, that if you have benefits that came through in October that are still on your EBT card, those can still be used. Those don't lapse, and so that might be able to get you through a couple of days. But it's really a disruption. It's really frustrating that people are put in this situation.
There at the Lake County Health Department, Chris, I know you have to walk people through the eligibility requirements. Can you give us a brief rundown of what those are for people who maybe don't know?
For SNAP, yeah, SNAP is primarily a program for people with lower incomes, and so it's dependent on the income you have coming into your household or into your individual account that makes you eligible for that program, and it provides a sliding fee amount every month for what you're eligible for. WIC, on the other hand, again, is eligible for people who are pregnant or who have young kids, and based on income again, and that's really the key eligibility, that if you have income below the federal poverty level, then these resources are there to help you make sure that your family can be healthy and productive and be able to do the other things that you need to do.
Very quickly, last question. Governor Pritzker, we know, is going to be providing $20 million in state emergency funds. Could that help close somewhat of a gap if there is a delay in the federal funds coming in?
Absolutely. It's tremendous news that the state has put those resources into families and individuals who need them most. I think those food agencies and organizations will be working as quickly as they possibly can to take advantage of those resources, to get the food resources in and to get them out to the people that need them. But again, this disruption is entirely preventable, and really tragic that we put families and individuals in this position.
Well, glad we could get you on. Thank you for joining us to spread the word. Chris Hoff at the Lake County Health Department. Appreciate it.
Thanks.